Warning: watch this video or you will regret it. Have you ever felt a lump in your throat, difficulty swallowing, or pain when swallowing, as if something is stuck between your throat and chest when eating or drinking? If you think it's just a symptom of pharyngitis or acid reflux, you may be ignoring a serious warning from your body. Prolonged difficulty swallowing, especially when accompanied by weight loss, fatigue, heartburn, etc., can be an early sign of esophageal cancer, a silent, dangerous disease that is often detected too late. In today's video, we will learn: why is difficulty swallowing not as simple as you think? What signs need special attention? How to detect and treat it promptly? Don't take the feeling of choking lightly, because it can be an early warning bell from your body. Difficulty swallowing. The first signs of esophageal cancer. Difficulty swallowing, also known as dysphagia, is the earliest and most typical symptom of esophageal cancer, but it is easily overlooked or confused with common diseases such as sore throat, acid reflux, or gastritis. Initially, you may only feel a slight obstruction when swallowing solid foods, such as rice, meat, bread, etc. Then this condition will gradually progress, making it difficult for you to swallow porridge or water. The feeling of something stuck in the neck or chest, accompanied by a burning pain behind the sternum, is very uncomfortable. This is the result of a tumor growing in the esophagus, causing a narrowing of the food pipe from the throat to the stomach. Every day as the tumor grows larger, the food passage becomes more and more blocked, forcing the patient to change their diet, from solid foods to liquid foods, then only drinking water, but still feeling pain and choking. It is worth mentioning that many people are subjective with this symptom in the early stages, thinking that it is just difficult to swallow due to eating too quickly or due to mild inflammation. But when swallowing water also hurts, the tumor is at a dangerous stage and may even have spread to other areas. If you or a loved one often feel choked, especially if you are over 40 years old, smoke, drink alcohol, or have a history of gastroesophageal reflux, you should not delay going for an endoscopy. Other symptoms that are accompanying, don't ignore. In addition to symptoms of difficulty swallowing and choking, esophageal cancer also comes with many other signs that you may be unintentionally ignoring. These signs are often vague and unclear, causing patients to be subjective for a long time. One of the common signs is burning pain in the chest, especially after eating or when lying down. A dull pain behind the sternum, where the esophagus passes, can be confused with stomach pain or heart disease, but is actually a sign that the esophagus is being damaged by an invasive tumor. Another alarming symptom is unexplained weight loss. When swallowing is difficult, the patient often eats less, loses appetite, and the body consumes energy to fight the disease, leading to rapid weight loss and exhaustion even without dieting. In addition, hoarseness, persistent cough, coughing up blood, or vomiting after eating are also signs that need special attention. When the tumor spreads to the vocal cords or trachea, the patient may have prolonged hoarseness without a clear cause. Coughing up blood, even a little, should never be taken lightly. In some cases, there is also prolonged bad breath due to food stagnating in the esophagus, fermenting, and causing odor. This is a very late manifestation, indicating that the esophagus has been severely narrowed. The common point of these symptoms is they are not loud, not very painful, but they last for a long time, causing many people to only discover when the disease has entered the advanced or metastatic stage. Causes and risk factors. Who is likely to get esophageal cancer? Esophageal cancer does not occur randomly. It is often the result of a long-term, cumulative damage process due to many bad habits and potential risk factors. Knowing the causes will help you prevent the disease today. First, smoking and drinking alcohol are the two leading risk factors. Cigarette smoke contains hundreds of carcinogenic toxins, including substances that destroy the esophageal mucosa. Alcohol, when passing through the esophagus, will burn the mucosa, creating chronic inflammation, especially when drinking on an empty stomach. People who are addicted to alcohol and smoke for a long time are at 5 to 10 times higher risk of esophageal cancer than normal people. Second is gastroesophageal reflux. When stomach acid refluxes into the esophagus continuously, it will erode the lining, causing chronic inflammation, and over time can lead to a condition called Barrett's esophagus, a precancerous complication. Obesity is also a notable factor. Visceral fat puts pressure on the stomach, increasing the risk of acid reflux. At the same time, being overweight disrupts hormones and increases inflammation, creating conditions for cancer cells to develop. In addition, a diet lacking in green vegetables and fiber, but with excess red meat, pickled foods, and burnt grilled foods are also silent culprits. Familiar dishes such as dried fish, grilled meat, instant noodles, etc., can all create carcinogens nitrosamine if consumed excessively. Early diagnosis and detection, a golden opportunity for survival. Esophageal cancer is one of the diseases with a poor prognosis if detected late. But the good news is that if detected early, the 5-year survival rate can be up to 70 to 80%. Therefore, the most important thing is to diagnose as early as possible. Currently, the simplest and most effective method to detect esophageal cancer is upper gastrointestinal endoscopy. With just a small endoscope inserted through the mouth, the doctor can clearly observe the entire esophagus, stomach, and duodenum. If abnormalities are found, the doctor will biopsy the tissue to check for cancer cells. Many people are afraid of endoscopy because they are afraid of pain and discomfort. However, with modern technology, endoscopy is painless, takes only a few minutes, and you can request anesthetic endoscopy for more comfort. So who should have a regular endoscopy? Those are people with high risk factors. Over 40 years old, smoking, drinking alcohol. Prolonged gastric reflux, symptoms of difficulty swallowing, heartburn, and recurring chest pain. In particular, if you find yourself losing weight for no apparent reason, having a hoarse voice for a long time, or even choking when drinking water, you should not hesitate. Detecting esophageal cancer at an early stage is a golden opportunity to intervene with methods such as surgery, radiation therapy, chemotherapy, or endoscopic tumor ablation. On the contrary, if detected late, treatment will only prolong the time and relieve symptoms. Remember, don't wait until you are choking to the point of not being able to swallow before going to the doctor. It may be too late. A feeling of choking in the throat, difficulty swallowing, or pain behind the sternum. It's not just an inconvenience to eat, but it can be an alarm bell from esophageal cancer that is silently developing in you. This disease is not noisy, but when it breaks out, it is already in the late stage, making treatment extremely difficult. You can't see the tumor from the outside, but the body always has a way of speaking up. Listen to even the smallest abnormalities, and don't hesitate to get an endoscopy if the symptoms persist. One checkup, it can save a life. If you find this video useful, don't forget to like, subscribe the channel, and share it with your loved ones, because health is something that cannot be delayed. Let's prevent diseases early. Don't let a choking attack take away your future.